Hi, it's Crystal Lim, and I'm doing my presentation for Nursing 700. I'm going to be presenting a SOAP note to my preceptor. All right, we've got a patient in room 3. It's Mr. Arul Patel. He's a 38-year-old Indian American man here for a follow-up for his diabetes and hypertension. His chief complaint is that he's here to check on some numbers that he has for diabetes and hypertension because he says that they're not looking too hot. His history of present illness is that he has an increased thirst and urination for the past month. He's had a 15-pound weight gain, fatigue, discomfort, and increased worry over the past 3 months. The patient does have a glucometer, but he only sporadically checks his blood sugar at home. He doesn't like the discomfort of the needle stick. His past medical history includes hypertension, diagnosed 1 year ago, type 2 diabetes, diagnosed 5 years ago, general anxiety disorder, diagnosed 13 years ago. He denies any hospitalizations or surgeries. His current home medication regimen includes hydrochlorothiazide, 50 milligrams once daily at breakfast. He takes metformin, 850 milligrams 3 times daily with meals, escitalopram, 20 milligrams once daily with breakfast. He states all the last doses for the medications were this morning. He says that he has good medication compliance and adherence and hasn't missed a dose since he started taking them. He denies taking vitamins or supplements. He has no known drug allergies. His family history includes his mother having hypertension and type 2 diabetes. His father has hypertension. His social history is negative for tobacco and nicotine use, and he denies alcohol use. He does report having a sedentary lifestyle. He is a graduate student on a stipend income, and that does make some stress in his life, along with his family not supporting his career choices. He says that he does eat out frequently because it's easy, and he also eats when he's stressed with some comfort foods. He drinks 2 to 4 cups of coffee per day. His review of systems generally looks well. He hasn't had any recent sicknesses, and he does report being fatigued and weight gain. His GU, he has frequent urination, denies pain with urination or difficulty urinating, and he denies any changes in the urine characteristics. CV, he denies chest pain, shortness of breath, or any difficulty breathing, and a denial of history of blood clots. Neuro, he denies any dizziness. My assessment is that Mr. Patel is a 38-year-old Indian American who appears to be slightly anxious and overweight. He's visiting the clinic for a follow-up for hypertension and diabetes. His current vital signs are blood pressure is 146/49, heart rate 75, temperature is 37 Celsius, and his oxygen saturation is 98%. He's had a 15-pound weight gain in the last 3 months. When he was here 6 months ago, his fasting glucose was 142 and his A1C was 7.5%, And 1 week ago, his fasting glucose was 210 and his A1C went up to 9.3%. He did check some blood glucoses at home. 4 weeks ago, a random was 218. 2 weeks ago, a random was 220. Blood pressures checked at home 4 weeks ago was 142/96, and 2 weeks ago was 144/92. My general assessment of Mr. Patel is that he's a 38-year-old Indian American man with a history of diabetes and type 2 hypertension coming to the clinic for a follow-up. He's currently uncontrolled on both of those disorders and does not have regular compliance with monitoring them at home either, the blood glucose or blood pressure. He presents with symptoms of uncontrolled diabetes and hypertension and some weight gain. He's a graduate student under financial stress and has some stress related to his family and school, all of which are contributing to his health issues. My plan would be to do some medication changes for Mr. Patel. For diabetic control, I'd like to change his medication to a combo medication that's glyphoside/metformin, 2.5/500 milligrams twice daily with meals. And for hypertension, I'd like to switch him to another combo medication, lisinopril/hydrochlorothiazide, 10 milligrams/12.5 twice daily, hoping that'll help control his diabetic numbers and his hypertension a little bit better. I'd also like to educate Mr. Patel on regular exercise, making healthier choices with his diet, and referring to a nutritionist if we need to. Also to engage in some stress relieving activities where he can not stress eat, but be a little bit more relaxed, like yoga or something that he enjoys doing that would help with stress relief. I'd also like him to keep a log of his blood pressure and glucose at home and bring that with when he returns to the clinic in 3 months. And then also just to let him know if anything changes to come see us, if anything happens sooner, or if he needs, if he has any issues with the medication changes. Thank you so much.